The Cover Alabama Coalition held its first lobby day on Tuesday, March 21st at the steps of the State House in Montgomery. Faith leaders, community advocates, and people living in the coverage gap spoke about the importance of Medicaid expansion and then met with lawmakers to urge them to expand Medicaid.
We are here because our state needs to finally close the coverage gap and expand Medicaid. There are over 300,000 people in the state without health coverage or who are struggling to afford it, and that's not right when we have the option to expand Medicaid. This is our very first lobby day. We launched back in April of 2020 via Zoom. So this is really exciting to have our first really in-person lobby day rally and 3 years later after we launched. So really exciting.
As a hairstylist, I've got to be able to deliver when folks need me the most. That includes at the very end of the day when I've done 10 haircuts and everything is hurting. And I think it's time for our leaders to step up and do the same. I believe in full-time benefits and health coverage should be a minimum for me and the thousands of other hairstylists in Alabama. I see how other states do it by ensuring their residents can access health care when they need it. I wish Alabama would step up and do the same as well.
With Medicaid expansion, we can hire more qualified persons for our nursing homes and our hospitals and reopen our rural health care centers. I'm here to ask, along with my persons that we're involved with, Alabama Rise, that the legislators now, in this new year, have the compassion, the boldness, and the concern for their citizens to allow Medicaid expansion to be done in this state like other states. Thank you for listening.
I'm here to address an issue that is very important to me and I believe to many people here today. Some wonderful stories. As a cook who worked in Alabama restaurants for decades, I had to face a tough reality. I was uninsured, suffered from a health condition that prevented me from being able to continue working and support my family. At the time, I made too much money to qualify for Medicaid, but as a cook, our family didn't make enough to afford private health insurance. Despite working long hours and doing everything in my power to stay healthy, I eventually lost my job because of my chronic health condition. Unfortunately, my story is far from unique. There are over 200,000 Alabamians who are in the same boat as me. People who are working hard but still can't afford the health care they need to stay healthy and productive. That's why I'm here to voice my word to close that Medicaid coverage gap in Alabama, because it is so important. Not just for people like me, but for our entire state's economy and future success. The consequences of the coverage gap are massive. People who can't afford health care are more likely to put off necessary treatments and care until their conditions have either worsened, and by that time it can be costly and difficult to even treat them. This happened to me, and I was left suffering with a more severe illness, which in turn led to missed work days and eventually, like I said, losing my job.
It's very sad in the rural area that we see some of the people with the most chronic health conditions who do not have insurance. And what has that done? I've seen kids grow up and get sicker and sicker because they don't have health care. I retired from general pediatrics about 6 years ago, but I continue to take care of children with special health care needs, and I have about 100 of those that I care for. But you know who else I take care of? Young adults who don't have insurance. Some of them I haven't seen for several years, and they'll call me and say, please, Dr. Rollerson, I need my medication, and I can't afford to go to the doctor to get a prescription. So I have about 10 young adults up to the age of 30 who I'm also taking care of now.
When people suffer and die because the people in this building who work for us, I remind you, deny Alabama the basic necessities of life, which is health care, we must call them out, because this is shameful, it is wrong, and as a minister in the gospel of the gospel, I say it is also sinful. This is a moral issue. It is a disgrace that here in the richest country in the world, we fail to meet the needs of millions of Americans and leave people facing financial hardship, sickness, and even death as a direct result of their need for health care.
Also, remember your why we are out here, who we are out here for, who we are advocating for. This is bigger than us. Our people need coverage. And I imagine there'd be a lot more people here if they didn't have to work, if they didn't have other obligations to take care of. So remember our whys as we go through the halls and go to talk to our representatives. And just thank you for being here.